Hi, everybody. I'm Christina Morris. As Adrenia said, I'm here in Abingdon, Virginia, in the far southwest region of the state, and glad to bring you this information tonight. I have been a Revive master trainer for 3 years, and what that means is that I have the ability to actually train people to be trainers, as well as train community members to administer naloxone or Narcan, as we'll call it, tonight. So glad to be with you. I hope that I have some of our local volunteers on from the Southwest Virginia unit, and we're going to go ahead and get started. What we're going to cover tonight is to give you a briefing on the Revive program, the legislation that brought the Revive program to being in the Commonwealth of Virginia. We want to talk about addiction itself, and what it means to have an addiction to a substance, to understand how the opiate overdose happens, and how to recognize when someone may be experiencing an overdose or an opiate overdose. We're going to talk about how naloxone works. And like I said, we're going to probably refer to that more frequently as Narcan. Identify any risk factors so that you may know if you've got a family member, a coworker, friends that may have an issue with substance use and misuse, that you will know who might be more susceptible to an opiate overdose than others. We're going to talk about some myths about reversing opiate overdoses, and then learn how to respond. And we're actually going to I'm going to talk you through the steps of actually administering a Narcan to someone, and have you hopefully get a sense of what you can do and the tool that you can have in your toolbox to help someone in your community that may be experiencing an overdose. Since 2013, fatal drug overdoses have been the leading cause of unnatural death in Virginia. And I'm going off script just a little bit because today I received the fatal drug overdose quarterly report from the Office of the Chief Medical Examiner. And there's just some very interesting information that is up to date that I wanted to provide all of you so that you know what we're looking at in the Commonwealth of Virginia. As I said, it's been the leading method of unnatural death in Virginia, but opioids, and we're talking specifically illicit fentanyl, have been the driving force behind the large increases in these fatalities in the Commonwealth. They have contributed to 71.8% of all fatal overdoses in 2020. So of all the overdoses that we had in 2020, and there were 2,308. 71% of those, almost 72% of those, were directly related to illicit fentanyl. Fatal non-opiate illicit drug overdoses are also on the rise. Compared to 2019, cocaine overdoses increased by 33%, and methamphetamines increased by 95.5% in 1 year. Our preliminary numbers for fatal overdoses in Virginia, beginning the COVID pandemic in March of 2020, our fatal overdoses have increased and continue to be record-breaking. Fatal overdoses of all substances increased 41% from 2019 to 2020. So what you see here on this graph is we were beginning to see a little bit of a decrease in deaths from 2017 to 2018. And then 2019, there was a bit of a rise, and then there was a significant rise in 2020. And we think we're going to have additionally another rise in 2021. And just to give you something to compare it to, motor vehicle related deaths in 2021, 980, gun related deaths, 1,193. And fatal drug overdoses, 2,576. So that's what we're talking about in the Commonwealth of Virginia. And that's why it's important that we're having this conversation tonight. And we can put in your hands a tool that you can use if you need to bring someone out of an opiate overdose. We do have some legal protections, and these are legal protections that are part of the Code of Virginia. Good Samaritan law, we have Good Samaritan law that covers a lot of different people for a lot of different things, but we specifically were able to address the administration of Narcan in the Good Samaritan law. So if you have in good faith administered naloxone to someone that's experiencing a life-threatening overdose, then you cannot be held liable for any damage that may occur to that person. Also, a person who is not otherwise authorized to administer naloxone, meaning they haven't taken this class, but they happen to have naloxone with them and they administer it and they save someone's life, still that they're going to be protected by Virginia's Good Samaritan law. There are some other things that are extremely important, and this applies to individuals that find themselves in a situation where they may have to give someone naloxone, Narcan, and they are also potentially using at this event. Let's say this is a party and they're around someone, they may have ingested something themselves, but they would not be subject to arrest or prosecution if they, in good faith, seek medical attention for this person that is potentially experiencing an overdose, or if they give them Narcan. What we want to avoid is having individuals take folks that are experiencing an overdose and drop them at the hospital door and go away, or just don't give them any kind of care in a party situation or in a situation where they're around people that may also be using and misusing drugs. We want them to remain at the scene of wherever this overdose happened and to be able to talk with law enforcement, give law enforcement the kind of information that law enforcement requests, names, what they might have ingested, what they might have done, how long it's been since they've been in this state. They want to identify themselves as well, and provide any kind of information they can to law enforcement when they arrive on the scene. Now, if this is happening while the law enforcement officers are there and they're executing a search warrant, this does not provide that protection, but we want to encourage people that may be in the presence of folks that are misusing substances to know that they will not be prosecuted if they do the right thing to try to save someone's life. So that safe reporting was something that was important to get in the Code of Virginia to provide them that level of protection, ensure that they take care of someone that may be experiencing an overdose. Now, in the Commonwealth of Virginia, we have a standing order for naloxone. What that means is Dr. Oliver has basically written a prescription for the Commonwealth of Virginia, so that if you decide that you would like to have some naloxone yourself, you could go into a pharmacy and request it, and you don't have to show them a written prescription. Naloxone is available to anyone in the Commonwealth of Virginia that seeks it out. And so that has been in existence for a number of years. Gosh, it seems like, I guess, probably 5 or 6 years now. So you don't have to have a prescription from your physician to actually get naloxone. Now, I'll just say there are some physicians that when they write a prescription for a painkiller of an opioid class for a patient, sometimes they will give them that. And a lot of times that's because it helps to get their insurance to pay for it. And it gives them the opportunity to have a conversation with their patient about the potential for an overdose with this particular drug and this particular prescription, but it is not necessary. Now, naloxone can be obtained free of charge at any local health department in the Commonwealth of Virginia. We're going to talk about later a card that you're going to get for proving that you completed this class. You can take that card to your local health department and request a dose of naloxone. You will not be charged for it. There are some community service boards in the state that are also doing the same, that if you show up, you have your Revive, you can prove that you've had Revive training, that you want a dose of naloxone, they will be able to dispense that to you. And of course, course, all of your pharmacies, your CVS, your Walgreens, your Kroger, your Food Lion pharmacies, your local community pharmacies, but they may actually require insurance payment or out-of-pocket payment. It's not going to be free except for community services boards and health departments. Now, before you take your information into either the community services board or the health department, call ahead. Right now, still in the pandemic, a lot of health departments are short-staffed, and there has to be a clinician there at the time that you are there to actually dispense the naloxone to you. So don't just show up thinking that you can walk out with naloxone. Always call ahead and tell them what your intentions are so you can know when the office is going to be open, and do the same thing with your community services board in your community, so that they know that you're coming and you know that there's going to be something there, and it's not, and of course, every office is different now in the state as to what their pandemic openings and closings are. So just always go make sure that you call ahead to find out that you can receive your naloxone when you arrive. Going to talk about that. What we want to first talk about is addiction, and understanding addiction. I just had a presentation this past week with Dr. Stephen Lloyd. He used to be the drug czar for the state of Tennessee. I have heard Dr. Lloyd many times talk about addiction. He is in recovery himself from addiction. He was a physician that started taking an opiate that was left over from a dental experience. So a lot of people, and he says this time and time again, they don't plan to be addicted to drugs. They don't seek out. This is not something that they have decided, this is what I'm going to do. It is also not a moral failing that someone becomes addicted to drugs. Dr. Lloyd can tell you the date and the time that his addiction started. He remembers it from the very first pill that he took, that it took him out of the experience that he was in. It gave him clarity. It calmed his nerves down. And from that point forward, he was addicted. It changes you very quickly. It can. And some people can, to the minute, tell you when their addiction started. So it's not a moral failing, and we don't want to look at it that way. These particular drugs in the opiate class, they literally change your brain, and your chemistry in your brain is changed. So it's not something that you can control. I mean, Dr. Lloyd talked about this past week, those of us that want to lose our pandemic 20, what part of your brain is still allowing you to eat that ice cream every evening, even though the other part of your brain is telling you you need to stop eating that ice cream. So it's the same thing. It's your brain is driving this addiction. And so that's one of the things that we want to talk about very quickly. It controls your impulse, so that a person starts out and they think they can control it, and very quickly in their addiction, it is controlling them. It changes you physiologically, it changes your brain, it changes your body chemistry. It just changes everything about you, and you don't have control. You lose that control over that drug, and it begins to control you, and then there are negative consequences to that. And so we want everyone to understand that don't just think that you understand what addiction is. Really learn about what addiction is and how it starts and how what it does to individuals. So the next thing we're going to do is we're going to look at a video. This is a video that I think is one of the best videos I've ever seen for having people understand what addiction means to a person, it takes you very quickly through the whole timeline of positive to negative of what addiction is. So we're going to start this video now, and please let me know it can be seen and heard. Okay, Pat. So you see what I mean? It took over that nugget's life, changed him physically. It drove him to go from one point to the next. So it is something that quite literally changes a whole person's being. So the class of drugs that we're talking about specifically for naloxone is opioids. We mentioned earlier heroin, synthetic opiates like fentanyl, and fentanyl is what seems to be the scourge in Virginia right now. And then pain relievers that are available legally by prescription, but we also know that these are people are getting them and obtaining them illegally: Oxycontin, hydrocodone, Vicodin, morphine, etc. So that's the classification that we're talking about. Here are some of the names, the generic names, the trade names, and the street names. I will tell you these street names are quite old, and I'm sure they're changing on a regular basis. But we want to give you these street names just in the event that you have teenagers and young adults that are in your world and you hear them talking about things. Maybe you need to know what this list is so you can go, what are they talking about? If they're talking about China white, they're probably talking about fentanyl. If you hear that coming up in conversation, that you probably need to have a conversation with those teenagers and young adults. But this is the generic name that most of us know things by. You know, carfentanil is wild nil. Tramadol, probably some of you've had tramadol, oxymorphone, hydromorphone, morphine, oxycodone. So we wanted to give you these names so that you would have a reference point in case you heard about these things, and also so you will know if you're having surgery. Let's say you're having knee replacement surgery and they want to put you on an opiate for pain. You can know what they're talking about and start asking questions about it. If you don't want to get opiates in your life, then maybe you want to say, what else have we got besides these things in this classification? So what is an opiate overdose? In our receptors, remember we talked about this is changing your brain. In our receptors, in our brain, we have many receptors for opiates that control the pain in your body. That's the whole point of an opiate is to control pain. So those receptors in your brain that are pushing out the pain, those opiates fit exactly on that receptor. And so just as you get more and more opiates into your system, then more and more of those receptors are going to be fitted with an opiate molecule, and that's going to slow your body down. That's going to slow your heart rate down. That's going to slow your breathing. That's going to drop your blood pressure. All those things that keep a person alive are going to be depressed because of the overflooding of opiates in the receptors in your brain. And so what we're wanting to do is we're wanting to clear out your brain of those opiates so that your body will start functioning once again, or not yours, but a person's body will start functioning again, and they'll come back to life. So we want to talk about some risk factors for opiates. Certainly, there are a classification of individuals that are at a higher risk for overdoses than others. Prior overdoses makes them really susceptible to another overdose, because it just, every time you have an overdose, it weakens your system to be strong enough to fight off the next one. So prior overdoses are a real red flag. Reduced tolerance if someone has been incarcerated and they've cleaned up, if someone has gone to recovery and they've cleaned up, if they have just stopped using on their own, if they've been ill, if they've received some treatment of some kind. Anytime that they're sort of flushed opiates out of their system, many times those that misuse opiates, they go through recovery, they go through withdrawal, they go through abstinence, and then they decide to use again. They decide to use at the level of drugs that they were using before they quit. So rather than one pill, before they went into recovery, they were using 3. So they go through recovery, they've gotten themselves clean, they decide to go with 3 pills again. So their tolerance to that is greatly reduced and could potentially lead to an overdose. Mixing drugs. And one of the things that I wanted to tell you from the Office of the Chief Medical Examiner's report that I thought was very interesting today: often drug-related deaths have more than one drug causing or contributing to death. Therefore, deaths in which multiple categories of drugs cause or contribute to death will be represented once with each drug category. So even the Office of the Chief Medical Examiner recognizes mixing drugs is highly usual in the Commonwealth of Virginia, and certainly is something that would lead to an opiate overdose. They may be drinking and taking OxyContin. You don't know if they're having an alcohol overdose or an OxyContin overdose. So that's why you need to give them Narcan to get them out of that overdose. But this is very common. And so one of the things is you may think that someone is simply an alcoholic. That's all you've ever seen them use and misuse is alcohol, and they pass out. You still want to be encouraged to give them Narcan, because 9 times out of 10, they've got something else in their system other than alcohol. And if it's an opiate, this may be the one thing that saves their life. If they don't have any opiates in their system and it's simply an alcohol overdose, then it won't bring them back out of that. It won't hurt them if there's no opiates in their system. But if there happens to be opiates in the system, there may be just enough to open up those receptors and start their body functioning again. If anyone uses alone, of course, that's a high risk for any kind of overdose. Variations in strength and changes in formulations. If you go from a quick acting drug to a long extended release drug, I'm worried about that for my older mother whenever the doctor starts trying to change her medications. If we're going from quick acting to a slow release, that concerns me. So that's something to be watchful of with family members and friends and people that you know. And any kind of medical condition such as a chronic lung disease, kidney disease, or liver disease. Those are all this is the category of folks that this gives them real risk factors for an opiate overdose if they happen to have a prescription for it or if they're using it illicitly. So signs of an opiate overdose are very different from someone that is just really high. If you've got someone that's just that they've got a real buzz going, they're just going to be real relaxed. You can talk to them, you can potentially probably have a conversation with them, but if they are overdosed from an opiate, you will not be able to rouse them. You will try different things, and we're going to show you different things to do to try to rouse them and see if that you can get them breathing and up. But being relaxed versus passed out is a big sign of a difference. Their speech is slow and slurred if they're just really high. But if they're overdosed, they may not be able to speak. Their breathing may be so slow you can hardly hear it. They also may have what we would call a death rattle. It's a very deep snore or a very strong gurgle. It's not just, it's much more than a snore. If you hear something like that of someone, you need to pay very close attention to that and give them some attention as soon as possible. If they're responsive to a shouting, a sternal rub, pinching their earlobe, they're just really high. But if they don't respond to that at all, and we're going to show you the sternal rub, then they're potentially overdosed. And their pupils will be contracted and very small. You'll also see skin tone that's changed with an overdose. They'll be blue, or they'll be ashen, they'll be purple. Their nail beds will be blue. Those are the kind of things to look for with the difference in an opiate overdose versus someone that is just really high. And again, we talk about that unfamiliar sound while they're sleeping. You know, if you have someone that you regularly hear their snores, that's what puts you to sleep at night. But if you start hearing something that is very different, it's a rattle in their chest, it's a gurgle in their throat, you need to take note of that. Now, we have a lot of myths about opiate overdose and how to get someone out of an overdose. And these are the things that we do not want you to do. That's why we want to give you the tools of Narcan so that you can do the right thing. Don't put this individual in a bath. They're going to be dead weight. If they're not breathing, they could easily go under the water. They could drown. You don't want to induce any kind of vomiting or give them something to drink, because again, their system is not functioning, so they could actually choke on the vomitus. So you don't want to induce any kind of vomiting. You don't want to put them in an ice bath, because their body system is already depressed. Their temperature is already dropping. So you don't want to cool them down any more than they already are. You don't want to try to do anything that's going to cause them any harm, slapping them, kicking them, hitting them in the back. We're going to show you the sternal rub and the ear pinch. That's really the bulk of what you should do, because you don't want to cause anything that's going to cause any harm. And then we've heard this time and time again from those that misuse substances is, they'll drink a whole gallon of milk, or they'll inject salt water before they inject whatever they're injecting. Those are kind of things that are not going to save someone for an opiate overdose, because remember, it's going to the brain. So milk is not going to the brain, milk's going into the digestive system. So we want to make sure that we don't do anything that's going to harm this person or cause an infection maybe down the road. So these are the kind of things that we do not want to do for someone that may be experiencing an overdose. So what we're saying tonight is naloxone is the only effective response to an opiate overdose. It has been tried and proven across the country. So what is it? And I don't know if y'all can see me, but naloxone is a medication. It was designed to be used by emergency medical services. And with the opioid crisis in this country, they were able to figure out a way to have doses refigured as injectable, auto-injectable, and prepackaged nasal, which is what we're going to be talking about tonight, so that actual non-medical persons could administer it and save someone's life. So we talked about the brain receptors and how those opioid molecules lay down on those receptors. And if enough opiate gets in your system, then it shuts that system down, stops the heart from beating, stops the breath. Well, what Narcan is Narcan is stronger than those opiate molecules. And once Narcan gets into the brain, it literally knocks the opiates off and allows the body's system to start working again. That's why you hear sometimes when people describe giving someone administering some naloxone to them, they literally see the body take a big, huge, deep breath because that's what you're doing. You're allowing the body to start functioning again. Now, it does it for a short period of time, 30 to 90 minutes. So you want to get help to that individual in as quick a period of time as you possibly can. But fortunately, what we've got through the health department is we've got something that is 2 doses, so that if you have to use the second dose or the first dose doesn't get a response in an appropriate amount of time, you've got a second dose to try to respond, to get them responsive in 2 doses. So this is what is available through the Virginia Department of Health's health departments is the Narcan nasal spray. You get 2 doses in a kit. It comes in a package that you pull apart, and it has the dose in here. It's a little, I hope you can see this. I don't know if you can, but it is it's a spray like that, like you would use for nasal spray for a cold. And you'll have 2 of those, and it's a 4 milligram dose. So you're going to have a total of 8 milligrams in the box that you receive at your local health department. Now, how do you store naloxone? It has a shelf life of approximately 2 years. Pat said that was a question that many of you were asking. And when you go to your health department, always check your expiration date on that. But I will tell you, if you have Narcan, you need to use it. It has expired. By all means, use it. I think we all know that, sometimes those expiration dates are a bit wobbly. I laughingly say down here, the only thing that I can depend on with the expiration date is my Duchess milk, because the day that it says it's going, it's going. But otherwise, this may still have some efficacy in it. So don't not use it if you feel that you need to. What you may have to do is you may have to give both doses to get the person completely awake for you. But don't just put it aside and say, I'm not going to use it just because it is expired. Please try to use it if you need to. You don't want to take it out in your car on the hot summer days. You don't want to leave it out in your car here in Southwest Virginia in our teens and snowy days. You want to keep it in a dark place. I keep it in my backpack. It goes back and forth to my vehicle. So you want to make sure that that's the case for keeping it safe. Keep it away from light, keep it protected in a dark place. As with all medications, you want to keep it out of reach and out of sight of children. But if a child happens to get a hold of it, and they squirt it and they've got it on their hands, or they even get it up their nose, they've got no opiates in their system, then this will not cause them any harm. Now, for those of you that may ask the question, what about giving it to a child? The dose for an adult is the same as the dose for a child. You may be able to just give them one dose and get them fully revived if you need to, but it is the same dose for adult and a child. There are very few serious side effects with this. They're extremely rare, and so rare that they would much prefer that you use it and revive someone and bring them back to life than not use it and worry about a side effect. As I said, it will not reverse anything other than for opioids, such as alcohol, cocaine, anything like that. It won't do it. There's no abuse potential. It can't be something that can be used. And as I said, it's the same dose for an adult as for a child. Now, how do you actually respond once you have your Narcan in your possession? First off, you want to check for responsiveness. We've talked about the sternal rub, and if you take your fist and right now, if you rub your hard knuckles against your breastplate, you see how much that hurts. If you're able to do that to someone that is down on the ground that you think is experiencing an overdose, if they don't respond at all to that, it's a very good indication that they're in an overdose situation. Another thing you can do is actually take the edge of your earlobe and pinch it as hard as you possibly can. That will typically get someone's attention. But you can also do, on their shoulders, hello, hello, hello. Are you there? Are you awake? Do you get any kind of response from them? If you've done all that checking and you've gotten no response, then you need to pick up your cell phone or your phone and call 911. Don't leave that individual alone. You want to keep them, you want to stay with them, but you want to call 911 and tell them that you've got the potential for an overdose. And you could probably tell them at that time you do have Narcan and that you are willing to administer the Narcan. You want to put that phone down with the line open with 911 because they're going to start EMS coming your way. They potentially, based upon where you live, may also have law enforcement coming your way. Most law enforcement officers in the Commonwealth of Virginia also carry Narcan in their vehicle or on their person. So a lot of times law enforcement can get there before EMS can. Then you want to give 2 rescue breaths, which is pushing back their forehead, pinching their nose shut, and putting 2 breaths into their mouth. You want to, out of your periphery, look and see if you see their chest rise. If you've done the 2 rescue breaths, then you want to take the naloxone out of its package, put it in their in one side of their nose, and push the plunger in. You may want to continue doing rescue breathing. Typically, the naloxone will affect them within 3 to 5 minutes, and you can see what kind of response that you're going to get. You don't want to leave them leave them alone at all. You also may want to say that if you're in a situation where there are a lot of people, you may want to clear the room so that you can be focused on this individual and what you need to do to administer the Narcan. But it's really important that you follow these particular steps and get these steps in your mind. So again, we're going to, number 1, check for responsiveness. Number 2, we're going to call 911. We're going to put the call on speakerphone and talk with them. They may have questions, but you want to stay there with that person until someone else arrives, either law enforcement or EMS, to take over the situation. We are not teaching CPR. We're not teaching chest compressions. We've just taught, so if they want you to do that, you probably will just tell them that you're just going to be doing rescue breaths. This is the recovery position that we're talking about. You want to lay that individual on their side with their top leg thrown over to sort of put them in a tripod situation so their body's sort of holding themselves up on their side. Put their upper hand below their chin. The reason you're doing this is in the event that they start coughing, they start vomiting, they're doing it out to the side so that they don't ingest any of that back in. It may be that they urinate, they defecate. So you want to be able to give all that away from them and projecting away from them. Also, it allows you to have better control of them in the event that they start fighting when you have revived them. Because what you're doing is you're throwing them into a very uncomfortable feeling. You're putting them into what they call dope sick. So you're taking all of the opiates out of their system. You're taking their high away from them, and that's very uncomfortable for them. It's painful for them, and so they may start fighting you. Or you may need to simply say, everything is okay. You're okay. You're breathing now. 911 has been called. EMS is on the way. You may need to reassure them, but this just gives you better control of that individual in that recovery position. If you have to go to the door to let 911, let EMS or law enforcement in, and the doors and the front doors in another room, put them in the recovery position while you leave them as well, because you don't want them to be back on their back while they're not breathing. Okay, so then we're going to give the 2 rescue breaths. After we've called 911 and got that going, you're going to plug their nose and give them 2 even, regular size breaths. Then you're going to administer the naloxone. If you look at this slide, what you're going to be receiving is the Narcan nasal spray that is on the right-hand side. In the Commonwealth of Virginia, we also can do the auto injector, which is the SVO. I'm not going over that tonight because that's not something we have available for you. That runs about anywhere from $150 to $200 a dose, but it's like an EpiPen. It talks you through the process. And then also in the Commonwealth of Virginia, we can do injectable naloxone, and some of you may live in communities where there are nonprofits that are actually teaching people. Typically it's those that are actually misusing drugs on how to administer naloxone because they've got a familiarity with needles and syringes, but that is not something in my part of the state that we're doing yet because we do not yet have a nonprofit that is confirmed to do that. So that's not why we're talking about tonight. We're just talking about the one that's on the right-hand side. It usually starts working within 30 to 45 minutes. We want a response, a second, sorry, and then we want a response in about 3 minutes. And that's what you're looking for. Now, you want to do the rescue breathing. Like I said, CPR, if you're trained to do CPR, but that's not what we're teaching tonight. You want to put, again, their person on their back, lift that chin up to open that airway, plug their nose, and give them regular breaths until you start seeing their chest rise on its own, or they start moving around. It could be that they move around. I had a deputy say that he thought he had someone that was completely deceased. He decided to do Narcan, and they literally sat straight up off the floor. So if you get that kind of response, that's wonderful. Then you want to assess how they are. Also, you might want to be aware of, in your community, how quickly does EMS or law enforcement respond? In Southwest Virginia, where we are, we rely heavily on volunteer EMS. And if they are all out on other calls, it may be a while before they're able to get to this part of the community and respond. And so I always tell in Southwest Virginia, or those that live in rural areas, keep that second dose handy in case you need it, because remember, this is effective for 30 to 90 minutes. And so if you start getting at the end of 90 minutes and your first responders haven't shown up yet, that person may revert back into an overdose. You're going to need that second dose for them. But also, you got that second dose. If they don't respond at all in the first 3 to 5 minutes, then you've got that second dose to give them, and you repeat it. You put that head back, you push the plunger up into their nasal passage and push it all the way to the top. And that will be your second dose that you'll be giving them. And that's all that we've given on. Now, as we said, people may wake up differently from an overdose. They are rarely violent, but they may be fighting you. They may want to get up and get to their works to get a high again. They also sometimes just may not realize what has happened to them. So you need to just explain to them, make sure that they understand that they're being cared for. People are on the way. They're not in trouble. They're actually alive. Just reassure them, and let them know that they could potentially relapse, depending upon how quickly or how long it took you to get them out and how bad they were. So what's next? For those of you that are here tonight, we're going to issue you a Revive training card with your name. I'm going to sign it and date it so that they know when you've actually had this class. With this card, you should be able to visit your local health department and request a free dose of Narcan. You will have to do an encounter form at that health department so they can log this in. Now, the Revive kits, we have a shortage of Revive kits in the Commonwealth of Virginia. Adrenia and I have been working on this now for 6 weeks, I think, to try to figure out how to get these Revive kits to you. I want to show you this kit. And as soon as I get done with this, you'll be able to see me, and I'm going to show you this kit and show you what's in this kit. It's helpful for you to have and to keep your Narcan, wherever you want to keep it, to keep all of this information together. Now, there's just some other things that I want to bring to your attention. I really wanted to do this in October for a particular reason. We in Southwest Virginia have been, for the past 12 years, been actively involved in the DEA's National Drug Take Back, and Drug Take Back is happening in October. We missed it last spring with the pandemic, but we had it last fall. This spring, and we're having it again this fall. You can go to the DEA Take Back website and put in your zip code and find out where the closest Take Back location is going to be for you on Saturday, October the 23rd. You can take literally everything that in your home medicine cabinet, prescription, non-prescription, over the counter, old, decrepit, whatever it is. The only thing that they won't take is needles. You can even take vaping materials to them now. So I just wanted to bring that all to your attention. I know there are other Medical Reserve Corps units in the state that are involved in drug take back. We're very involved here in Southwest Virginia. So I wanted to bring that to your attention. The other thing I wanted to bring to your attention is because it's going to be coming up on Hulu. I know some of you are probably going to see it, but there was a book written by Beth Macy from previously from the Roanoke Times about the opioid crisis in the Commonwealth of Virginia. And she highlights 3 particular communities, far southwest where I am, the Roanoke Valley and the Shenandoah Valley. And so if you've not got a real sense of where we are in Virginia and how these things started, this might be a very good book for you to take some time to read, or to watch the movie that's being released, I think next week. Certainly it's something that I'm very interested in, because we've had there are a lot of friends that are in this book, but it just gives you a good sense of what's going on in Virginia. And I wanted to just bring that to your attention. So we want to thank you very much for tonight, and I'm going to stop sharing so I can see you. I want to show you some things before we finish. So what I'm going to show you now is, because I've got Filippo here. I hope you can see him. Filippo, he has a name. Filippo is our CPR mannequin. One of the things that we discussed was the sternal rub. So you take your fist just like that, and you put it right in the middle of the breastplate, and you rub up and down. And if you rub up and down like that and you don't get any response from someone, then they're really out. Because if you do it to yourself, you know that really, really hurts. The other thing that we encourage people to do is take your finger and pinch the earlobe as hard as you possibly can. That will also potentially get someone's attention, because that hurts as well. But then there's always the, Filippo, are you awake? Are you awake? Trying to get their attention, trying to get them waking up. And then you're going to do that sternal rub to see if you see anything. You're also going to want to sit and see if you feel anything on your chin as far as a breath, or if you see that chest rise at all. So if you've done all that, you've checked for responsiveness and you haven't gotten it, that's when you need to get your phone and call 911, open up that line and get some help to you. You want to do those rescue breaths, which is pushing that head back pinching that nostril and doing 2 breaths right inside and seeing if you can see that chest rise. Now, the other thing that's important about it is now you're ready to actually dispense a Narcan. And I hope you can see I've got a nasal spray. And so what I do is when I push the person's head back and I put the first dose in the nostril that's the farthest away from me. That's just me, because I know if I've done it farthest away from me that I have to do the second one. I want to do it in the nostril that's closest to me. If you happen to do it in the same nostril, that's okay. It's not a problem. Because I know that this is going to be a stressful situation and you may forget and you go, oh, I did it in the same one. That's okay, because you're still getting it in their system. It's just that we want to use the nostril that hasn't gotten any kind of medication in it to try to get it up into their breathing and to get it into their brain to knock those opioids off those receptors. And so then once you've done the first dose, you'll go back to the rescue breathing. If they respond at all, if you see them take in a big, huge breath, if you even see them doing slight breaths, if they start moaning, if you do a sternal rub and they push your hand away, those are all good signs. That means that you have revived them from the overdose that they're in. If you have to go to the door to let in EMS, you want to put them in that recovery position so that they are not on their back, but they are on their side, safely waiting for someone to come in and help. Now, I want to talk to you about this Revive kit because there is some important information in that kit to bring to your attention. When you get this kit, you will have a CPR shield for doing the rescue breaths on Filippo. So you'll have 2 shields. You will also have gloves. And I know probably since if any of you have been working with us in the pandemic for the past year, you know all about these gloves. But we've got gloves for everybody. And then the most important thing is, Pat, I don't think I have them in here. There are stickers. And what you want is once you have given someone, Pat, go find me some stickers. Once you have given someone a dose of naloxone, you want to put a sticker on their clothing that says, I have received Narcan, or I think it actually says Revive. Put it on their clothes, put it in their clothes, put it on their hair. Don't put it on their skin because their skin is going to be clammy, but it's going to be a sticker that says, I have received naloxone. You'll get 2 of those in your packet. So if you give them 1 dose, they're going to have 1 sticker on them. If you give them 2 doses, they're going to have 2 stickers on them. That's why when they get to the ER knows that they have had at least 8 milligrams of Narcan in their system, and helps to know that they have actually, yes, duct tape does. I just saw that. Duct tape does help. But we don't want to put it on their skin, put it on their hair, put it on their clothing, stick it on their pants, just somewhere visible so that when the first responders take them to the hospital, or even with the first responders arrive, they'll know that naloxone has actually been dispensed to them. So I think that's it for me. Now I know we've probably got questions.
We do.
Okay.
The biggest question is, can we receive a copy of the slides?
Yes.
Adrenia can post them, or we could have everybody email me.
Yeah, we have a Revive community training handout. And so I will be getting that to Adrenia, and Adrenia will be getting that to all of you. Now, one of the things that I want to say is, if you have an interest in being a trainer for your Medical Reserve Corps unit for Revive, please reach out to your unit coordinator and let them know that. There are master trainers like myself across the state that go and train people to be teachers. And so if you're willing to take on that and offer that to your Medical Reserve Corps unit, you could teach other volunteers. You could teach other groups that reach out. Right now, I'm still doing virtual classes. But if we can get through this next surge and the numbers start coming down, we might be able to go back to in-person classes. when you talk to your unit coordinator, you do need to have access to mannequins when you're doing the in-person classes, because you want the students to actually show you that they know how to do the sternal rub and do the plunger and all that sort of thing. But I just wanted to put that out there. If this is something that you would like to do, if you're an instructor, you already got training as a teacher, this would be a perfect thing. And all of our medical reserve corps units could always use extra set of hands to go out and do these kind of community events. All right, what's the next question, Pat? Okay, yes. Don't, if you're going to go get your naloxone at your local health department, please make sure you call ahead and to your local office and say, I've got my Revive card. I'd like to come in and get a dose of Narcan, and to find out when you can do that. Because some offices are still closed, or they're not letting a lot of people in for a lot of different things. They may be short-staffed. I know right now we're short-staffed in Southwest Virginia because we're out in the schools giving flu shots. So you need to call ahead and make sure that you can, that there's a clinician there that can dispense your Narcan to you when you arrive. And same thing with those of you that have community services boards that are also dispensing Narcan. Always reach out to those community service boards first and find out. Oh, yes. I mean, there are a lot of different people that are providing Revive training. In Southwest Virginia, Appalachian Substance Abuse Coalition is regularly doing Revive training. I know that my friend Kate Bosman, before she left Richmond, I mean, Kate and her crew were going out to bars in Richmond and doing the 5-minute naloxone training. So there's a lot of different opportunities for training. And the other thing I would say is, if you want to have, now that you've had this training tonight, if you'd like to have it at your church or for a community group that you're involved with, Rotary, Kiwanis, PTA, go to, there's all you've got to do is Google Revive Virginia, and the Department of Behavioral Health's website will pop up, and a point of contact, and they can help you secure someone to do training for you. No, you don't. You do not have to close off one nostril when you administer the naloxone.
An instructor, who do you call? How do you find out?
If you want to be an instructor, probably reach out to me, and I can put you in touch with the individual at the Department of Behavioral Health, because they have to actually come and watch you train. And I'm not sure what with COVID right now, what they're how they're handling that. But if there's anyone that would like to be a trainer, get in touch with me, and I'll get you I'll get you connected to the right people.
When you were talking about the trade names, are those the brand names?
The
like
generic
Oxy?
Names are not the brand names. Yeah. Okay.
So if you give 2 doses and there's no response, couldn't that just mean there's a different cause than
Yes,
an overdose?
it absolutely could mean that
But
there's a different cause.
but
But what you want to do is you want to continue to do rescue breathing until first responders get there. Because as we said, people are mixing. So if they've overdosed with cocaine, which is not an opiate, then that certainly could be the case. So you want to continue to do rescue breathing. Like I said, if you know CPR and you're comfortable, you can certainly do that. But you want to continue to try to help them until first responders arrive.
Suppose someone falls, breaks their nose is bleeding. You can't, are we out of luck?
Ooh, gosh, that's a good question. I've never had that question before.
That's a new, I know.
Ooh, that's a new question. I'll have to investigate that. Gosh. Okay.
Are some people more likely to become addicted to others? Did you discuss that?
No, there's different people talk to you about different scenarios. There are a lot of people that believe that there are some people that have a higher propensity for addiction over others. I think that's certainly, there's a couple of schools of thought there. I think the main thing that we need to be concerned about is that addiction happens to a lot of different people for a lot of different reasons. And how they got there is really not as important as how we can keep them safe and how we can get them into recovery.
Goes to the drug while you're near the person, or, you know, suppose you touch something or breathe something.
Well, I mean, that's why you got the gloves. Because, you know, we all know about carfentanil and how deadly it is. And so we certainly want to keep you as safe as possible. And right now, we're all supposed to be wearing masks, which is good if you're in close proximity. But that's one of the reasons why, you know, as soon as you can get to a situation where you can completely scrub down your arms and your face, please do that. Because we have had here in Southwest Virginia, we have had law enforcement officers succumb to exposure after saving someone's life. And fortunately, you know, there were other first responders there that were able to quickly give them Narcan and get them revived. But there is that potential.
How will everyone get their cards?
That's still up for discussion. We had discussed putting it in your VDH profile under your training tab in the Virginia Volunteer Health System. But we also can mail it to you, since we've asked everyone to do the Google form for your attendance and give the private phrase. And in that Google form, we're asking for your mailing address. So that's how, well, if we don't get it into your Virginia Volunteer Health System training profile, then we will mail it to you. And then as soon as we know how to get you the Revive kit, we'll be doing that. Now, for any volunteers that are in the Southwest Virginia unit, Pat and I have enough kits to send you yours. But for anyone outside of Southwest, we're still working on the details of getting you those kits since they're behind. You don't have to have a Google account to notify us of your attendance. You just need to get the Google link, put it in your browser, and it just opens and you answer the form. So you don't have to have a Google account. That will open in any kind of browser, I believe. Right, Pat?
Mm-hmm.
Yeah. Can you resend the Google form and phrase, Pat?
I just did and it disappeared.
Okay.
I'm doing it again.
He will do it again. All right. What else? Yes. Ms. McCabe has her hand up. I don't know how to.
She's going to have to put it in the chat box or question.
Okay. Okay. All right. Other questions?
Can you get CEU credits for today?
No. And also, if you decide to teach this class, you cannot teach law enforcement officials. They have to be taught by a different trainer in a different environment. So you may train volunteers, you may train community members, you may train nurses, doctors, but this is not for, she says the form does not ask for your mailing address. Adrenia, the form that I looked at had one with a mailing address. Can someone please check that? Thank you, Susan Hawk. Okay. We will check that. No address. I'm sorry, folks. It was supposed to have an address. Okay. Well, if you're all medical reserve corps volunteers, we'll be able to figure it out. It's just going to be, with 245 of you, it's going to be, somebody's going to have a job to do. It's not going to be me. Okay, Pat says it does ask for the email address. He's opened it. And you've just posted it again? Okay. All right. Well, we'll keep trying. What else? Any other questions? Thumbs up. This was good. Good. This is my second time to do virtual. So good. I'm glad this was good. And I'm glad to see so many of you on tonight. And let me just say, this is just a tool for you to have in your toolbox. You just never know when it's going to be something that you are going to need. And hopefully you will never need it. But wouldn't it be better to have it and not worry in case you get in that kind of situation? So I really appreciate you coming tonight. Lots of thumbs up. I like seeing that. Again, if you would be interested in being a trainer for your Medical Reserve Corps unit, please reach out to your unit coordinator and let them know that. I'm sure they would be appreciative of that. We would love to have more and more Medical Reserve Corps members that are prepared for helping someone in this kind of crisis, just like you've helped us with all these other crises that we've been dealing with. And I just want to say, as a unit coordinator, from the bottom of my heart, we cannot thank you enough for what you have all done since March of 2020. It has been nothing short of historical and extraordinary. I don't even have superlatives anymore. I know what's being done in my region, and it is historical, and it blows me away every day. And I think I speak for my other friends across the state when we say we love you all so much. You are doing extraordinary work. The fight is not yet over. We're getting a little bit closer every day, but thank you for all that you have done to support the health department and our local offices during this unusual and extraordinary event. So thank you all very much. I hope you all stay